The honest truth is like time and a well-structured physical therapy, right? Everybody comes and they want the injection that will get them back in 6 weeks. And the truth is, I always tell everybody, like, an injection is an aid to allow you to get the movement, right?
Yeah.
If I put all the right stuff into a tendon, the way that that tendon heals is by seeing a load. The way that it sees the load is through structured physical therapy. That is how we heal tendons, right? And so we have to apply a load to that tendon. Anything that I'm doing is an adjunct to help us get over the pain process or to help us to get around that block that seems to prevent us from adding load appropriately. So the answer at the end of the day is always PT, right? I never do anything in a silo or by itself because the PT is so important. However, when we think about other things that we may do to help us get over that pain hump, there are a number of different modalities. And what is most important, it's not a specific modality, but matching that modality to the patient in front of you. And so there are some patients for whom dry needling makes a lot of sense because it's really more myofascial or muscular. There are other patients for whom something like PRP or prolotherapy, which is, I use sugar water, but it can be any one of a number of things, which is meant to try to initiate an acute inflammatory reaction and then stimulate a healing response. That is really more targeted towards tendons. So chronic tendon issues, that can be quite helpful as well. So either of those. Also, PRP is certainly used for like osteoarthritis, chondromalacia, like thinning of the cartilage within any of your joints, meniscal pathologies, those sorts of things. PRP can be quite helpful as well. But again, none of it really works in a vacuum. It's got to be paired with appropriate physical therapy. And so I know that all of my like regenerative colleagues are like, oh, I can just do whatever. But the PT piece is so important and the movement piece is so important. Also to retrain normal movement patterns. I always tell everybody when you get an injury, right, it sends a pain signal and then your body's like, okay, I'm not going to move through that pathway anymore because it is painful. And so acutely, yes, that makes sense. But long term, when we have more chronic issues, you've turned off all of these muscles. They're weak. They don't know how to engage. Other muscles are super active and over engaged. And so we need a physical therapist to kind of retrain that normal movement. It has nothing to do with changing the arthritis in the knee. It is just about retraining the normal movement patterns. And sometimes that's all a person needs, and so often they're coming in asking for something. You're like, really, I believe very strongly that like, I'm not going to do anything the first time I see you aside from physical therapy.